Multisoft Virtual Academy, with over 21 years of experience, offers 1,500 plus courses, partners with 10K plus experts, serves 2,000 plus corporates, has trained 1 million plus individuals, and earning a 4.5-star rating. Here we share the overview, benefits, and facts.
So here I have some basic introduction or quick refresh about who's a payer, who's a provider, who's a subscriber member, and so on. Let's get it refreshed for some time. So payer, I think you're well versed. Payer is a person or an organization who is responsible for getting up plans. So when saying to a payer, we have different types of payer. So government payers, private payers, self payers. When you say government payers, they are majorly two things. One is Medicare and Medicaid. John, if you don't mind to keep the session interactive, can you tell me what is Medicare and what is Medicaid?
Yeah, Medicare is Medicare Advantage. Government's funded by the federal government. And Medicaid is typically, it's federal government funded, but it's also state-driven healthcare.
Correct. So both are like it's a government-based plan, and for Medicare it is okay. We'll have this session. Okay, government plans we have Medicare and Medicaid. So private payers or something like commercial plans where you can put yourself customized according to your requirement. So basically, when it comes to Facets in a real-time environment, we'll say it as HMO plan, PPO plan, EPO plans. So on. So when you say it is a commercial plan, it all belongs to private payers. Self payers are someone who customize with your own requirement, which is paid from our pocket. So these are self payers. So I'll give you brief explanation about Medicare, Medicaid, what are types under Medicaid, all in upcoming slides. So going to subscriber, what is the difference between subscriber and a member, John?
Subscriber owns a policy, member can be a part of the policy, but not.
Correct. So when you say you're taking a plan, you will be a subscriber. The dependents under you will be your members, spouse, children, father, so mother. So they all will be a member. So when you say it into a Facets term, the subscriber member eligibility plays an important role in claims processing. So we'll talk in detail about this when we come into a claim monitoring. So member, as we discussed. So provider, who's a provider?
Typically a doctor, a hospital, or a facility that provides healthcare service.
Okay, it is generally like it is not only doctors, not only nurses. It is like whoever gives a service to treat for illness. So those are called providers. It can be like individual providers or institutional providers. When you say in individual providers, they are like doctors, nurses, dentists, therapists, all those things. Institutional providers are hospitals, clinic, diagnosis centers, pharmacies, even some therapeutic equipments. All those things are also called as comes under provider. Okay, so when you say in a health plan, taking an insurance, since you already live in US, you should be well versed knowing about this copay, co-insurance, detectable out-of-pocket expenses. So yes. So copay is some fixed amount that you're going to, again, max out of pocket is some maximum amount that it will be fixed when you take a plan. When you reach the maximum out of pocket limit that is paying from your pocket, when you reach that amount, from that onwards, the insurance will pay 100% for all your visits. So here's a quick example that gives you a brief. So you let's consider there is a service taken by you and the deductible is $4,000. Copay is $100, co-insurance is 20%, and the max out of pocket is fixed to $50,000, and your medical claim is $20. So, okay. So since your medical bill is $20, so $1,000 anyway you're going to pay, which is 20,000 minus 1,000 will be a 19,000. So undetectable, again you're going to pay it from your pocket. So 5,000. So 4,000 plus 1,000 is 15,000. 4,000 plus 1,000 is 5,000. So $20,000 minus 5,000 is 15,000. So in that 15,000, what is your 20% co-insurance, which is 3,000.
Right.
So totally you will be paying 4,000 plus 1,000 plus 3,000. So $8,000 you will be paying from your pocket. So the and your total amount, bill amount will be $20,000. So what happens? $8,000 you should pay it from your pocket, and the remaining $12,000 insurance will pay. Clear?
Yep.
Yep. So if this is the first visit, let's consider in the second visit, again you're paying some amount. Third visit, you have reached your max out of pocket. Meaning $50,000 already you have paid, 8,000, some 10,000 as a cumulative from your pocket expenses. When it comes to some number of visits, you have already paid $50,000 from your pocket, which is you have already reached. From then onwards, if your medical claim is $20,000 or whatever it might be, the insurance company will take its ownership and it will get paid. It is not that you're going to pay. Clear?
Yep.
Okay. So coming to plan. Yes, plan is again a health insurance term, where it is like a specific package that you can get availed as per your needs. Suppose in your home, elder persons may be there, 60 plus may be there, 70 plus may be there. They might need a cardiac service, or they may need a kidney related functionality services, or lung. So depending upon that, you'll be able to choose your plan. It can be either so that is how a plan decides. So the basic rule, and again when you say plan, it is like reducing the maximum amount, and you'll be able to get the benefit out of which the insurance you have taken to your pocket. So when you say a plan, what are the basic set of rules that it determines is what healthcare services these plans get covered, how much you pay, what is the premium you're going to pay, whether according to the services you're going to avail, under your plan, how many doctors are being covered, how many specialists are being covered, what are the hospitals that are being covered. So those are the key features that you need to look into it when you're going to choose a plan. So again, what a plan covers, it covers all doctor visit, hospital cares, medicines. Coming to cost, again, we discussed like a copay, co-insurance, deductible. When you say network, there are I'll come to network later. There are two types of network. One is in network and out of network. Network plays an important role while choosing a plan, whether you'll be needed in network providers alone, or even out of network providers. So when you say in network provider, there will be a particular region where providers or PCPs or specialists that you can avail only in that particular region. That is called in-network. When you say out of network, suppose let's say you have taken a service for a plan with an in-network, where you need a cardiac service, but that is not, unfortunately, it is not covered in your in-network. And if you need to go to an out-of-network provider, by that time, if you have not availed with that plan, the cost will be more higher. So that is the reason we are saying, so whenever you're choosing a plan, you should be very cautious of how you're going to get the treatment and what are the illness you're going to get it availed. So that comes into picture here. So then rules, again, so what are the referrals, what is pre-approvals, how many limits, even all those things comes in picture when you say a plan. So next, what is type of insurance program? So when you say Medicare, so Medicare is basically, so Medicare, Medicaid, both are government plans. So when you say government plans, obviously the premium or the benefits you're going to get out of it is going to be much lesser, and it cannot be customizable. It is basically made for the people for the elderly people or people below poverty line. So for that, the government program has been introduced. When you say Medicare, it is for aged about 65 and older. It is a government plan, and it is not alone for the people who are aged 65 and above. There are some exceptions, like younger people with disabilities can also be part of this Medicare, and some specific conditions like end stage kidney diseases can also be part of Medicare. So it is all like next. So I think we have covered with Medicare. So Medicaid. So Medicaid is again a government plan. So this is mainly for people who are under poverty line. Whoever has low income will be a part of Medicaid program. So even this is also run by both federal and state governments, and it is also under United States federal HIPAA Act. HIPAA Act, and this Medicaid is for so who can get who will be eligible for this Medicaid is for people who are under who has very low income, who cannot afford much for their illness, will basically go under this Medicaid. So who are all eligible? So when it comes to Medicaid eligible, we can say first criteria is low income, next is children, next is pregnant women, elder individuals, people with disabilities. So basically these are all exceptions, but when you say Medicaid, it is like low income adults and for pregnant women. So these two will get max out of benefit with this Medicaid plan. So what does Medicaid cover? Medicaid again covers doctor visit, hospital stays, long-term care, like even if there is like a skilled nursing facility needs to be taken, or home health needs to be taken. So for a long time, that will also be covered under Medicaid. Preventive services, drugs. So why I'm saying what is covered under what is, it is not that even if it is a government plan, both Medicare and Medicaid, even if it is for low income people with less premium, it also covers to the max where the federal and state government makes the people benefit, and for their makes benefit for their people. So this is what about government plans. Government plan is Medicaid and Medicare. So commercial plans. When you say commercial plans, these are like pre-built plans, basically a private companies where it is not related to government. So when you say private, again the premium will be more compared to the government plan, and again all the coverage and services offered will be more when compared to government plans. So when you say again, it is also comes under HIPAA Act, mostly like Aetna, Healthcare, UHC, Blue Cross. So these are some of the examples where commercial plans plays an important role. Next, who gets commercial plans? Either it can be a group insurance or individual insurance. So what is a group insurance? So group insurance, when you say you're working to a company and the company takes a group policy where they make benefit for their employers. So those are called group insurance, and individual insurance is something like you take it on your own to get some extra additional benefits. So in this case, you might come and ask me, what if I get both group insurance and individual insurance? Suppose if I'm a person who's already working in an organization, and the organization is already providing me a insurance benefit with an insurance for me and my family. So now I'm going and taking again and buying my own personal private insurance with my own plan being customized. So what is the use, why it is necessary? When I say I'm going to take two different plans, one is group insurance and another one is individual insurance, it is like dual eligibility, where suppose if you're going to get it is like you are being offered into two different plans, one is with group insurance, another one is individual insurance. So how it is benefit when you have a two individual insurances. Suppose let us consider you have taken a plan under plan A and plan B. So you are going for an any surgery or any kind of illness to a doctor and to a provider, and a provider is providing some kind of surgery, some kind of any kind of services, and he is offering some basic amount of bill. Let us consider if your plan, this is group insurance is your plan A and individual insurance is your plan B. First, primarily, as per your first plan, some again like premium, copay, co-insurance deductible, everything will be deducted, and some basic out of pocket will be paid from your hand, right? So that amount you can get availed with plan B. So basically your out of pocket expenses will be very very less when you have a dual plan coverage. So that is why we need to set like when I say it in a facets terminology, there might be claims like where provider is billed with a subscriber for dual enrollment or dual eligibility, where the payer where the provider is asked to select which plan will be your primary and which plan will be your secondary. So basically the coverage or the benefit whichever is providing higher will be your primary eligibility plan, and the least will be your secondary. So that is how you can get the maximum benefit by the payer. Any doubts in this, John?
I understand.
Okay, fine. Next, so again, types of commercial plans. So when you say commercial plans, there are many types. So one is companies to employees. Next is directly purchased from the insurance. Next is managed care plans. So HMO, PPO, and EPO. So HMO, PPO, EPO plays an important role in a facets world, where I would say most of your customers will be enrolled with commercial plans. So when you say commercial plans, these three are very, very important: HMO plan, PPO plan, and EPO plan. HMO plan is health maintenance organization, PPO is preferred provider organization, EPO is exclusive provider organization. So when you say HMO, again, HMO, PPO, EPO, all are customized plans. These are commercial plans. They mainly focus on like less premium. Uh, uh, yes, comparatively, it is less premium with a network of doctor focus on coordinated and cost control care. So here, when you say HMO, what all it requires? First, a PCP will be there. So so when you suppose, let's say you have a some knee problem. Suppose you have some knee problem, but you know that you need to go to an ortho doctor for that. But if you are enrolled with HMO plan, you cannot go to a specialist directly. So you should go to a PCP provider. Via PCP provider, he will redirect you to the specialist. Only then you can go to the ortho provider and get the treatment get done. So basically the HMO is for only for in-network providers most of the time, and in some exceptional emergencies they do offer out-of-network providers. So this is low premium and low out-of-pocket cost. So again, it is limited provider network. When you say it is in-network, you can get benefit only with the limited PCP and specialist within that network. So it is limited to providers. Next, referrals is required for specialist. As I told, you cannot go and visit directly to a specialist when you know, even though it is a specialist is required, you will be redirected only via PCP. So referral is always required for a HMO plan. No coverage outside the network except emergencies. So as I told you, so basically, this can give you a very brief. This can explain you very well. HMO meaning referral is required, in network stay only. PPO, no referral is required, either for in network and some of out of network, some amount for out of network coverage. EPO, no referral required, but strictly only for in network. If you go, if there is a necessity. So when you see claim, so claim is, so as we all know, claim is like a formal request that a provider sends to a payer to get the benefits out of which the insurance has been taken, the plan has been taken. So it can be like many things. How it works: patient visits a doctor, he provides the treatment, then the provider sends bill to the payer stating these are the services being taken, these are the equipments being used, these are the prescriptions, these many services, everything. He will have it in a detailed structured form. We call it as a claim form. Send it for review. Once the insurance company, meaning the payer, reviews it, he sends, if at all any procedure or diagnosis being wrongly configured for the services, he sends it back again to the provider stating these are wrong, that the claim form needs to be corrected again. So that we call it as rejected, denied claim with an error message. So um, so again the provider needs to correct the claim form, send it back to the insurance company to get it availed from the payer. Suppose there might be other scenario as well, where a provider where a subscriber goes to the provider, takes the services which is not part of the plan, which is already covered, that the provider doesn't know, but still he sends the claim form to the insurance. And some cases he say this is not part of the plan which the subscriber has been taken, so the plan, this is not covered as part of the service, and the claims get rejected. So basically the claim flow is also there, claim life cycle is there. I'll take it in later sessions. Either a claim can get it settled fully, settled partially, it can be denied, it can be errored out, it can be rejected. So what are the mandatory things for a professional claim, how the professional claim behaves, and what is the institutional claim, what are the mandatory fields, how it behaves. It is a deeper session in Facets. I'll show you how it works with a real-time example in Facets screen. Okay. So we'll move to it later. So next is eligibility. So eligibility, when you say eligibility, so when a provider or when a member or a subscriber is very first thing, what is eligibility? So very first thing, member or a subscriber or or provider or even institutions, it can be anything. The first thing is they should be availed with any one of the plan under any payer. So that is the first thing. Second thing, they should be active with that enrolled plan. Third thing, they should be enrolled into the policy. Fourth thing, either the treatment is given or not, either the service is required or not, the plan should be effective as on the day when the service is being provided. So next again is lastly, suppose if I'm a person going to an insurance company and getting a plan with a sum assured amount of 5 lakh rupees, say in your terms $50,000. If I'm exceeding my treatment more than $50,000, then obviously the service will not be covered. and either you need to top up or you need to take a plan. So these are all the basic eligibility that are required before even you're going for a visit or going to submit a claim or whatever might be. So during the eligibility, what is mainly checked? Whether the insurance status is active or not, plan details like HMO, PPO, Medicare, Medicaid, to which plan the particular subscriber or a member is being enrolled, what is the coverage date, when the policy is being covered from, whether it is a calendar year or it is a financial year, everything that needs to be covered. Next is what type of treatment or what type of coverage the plan is being offered. So all those things will be checked. Next is patient's responsibility to check how much the premium that we need to pay, what is the copay amount, how much deductible, what is the coinsurance percentage. So all those things should takes into picture when it comes to an eligibility check. Next, coming to capitation. So since you have already worked into this capitation providers, I'll not take much time into it. So basically capitation is like per member per month plan. So per member per month plan is it is not that you're taking a plan for the entire year, for a calendar year. It is not like that. It is for a specific period, usually one member for 1 month. So who is a capitation provider, who will get benefit out of capitation? So it is like a patient who needs regular checkup or regular care for a certain period. Let's say okay, let's say when there is a patient with kidney disease and they are doing dialysis on they need to do dialysis on twice a day or thrice a day. So when you say that, it is like the patient needs services in randomly or several number of times within a short duration. In that period, if you say you have taken a normal government plan or a commercial plan, it is not going to work, because it is going to be restricted with your visits, or even every time when you go to a visit, you need to pay some co-insurance, some amount you need to pay from your pocket. So in order to avoid that, the capitation is being introduced, and the capitation providers say like for 1 month, this is the standard amount you're going to pay to the provider, and irrespective of any n number of visits, the doctor can give services to the member. So that is how the capitation works. So no copay, no insurance, no deductible, nothing. It is just like what is the cost and how many visits, like for the entire month, this is the cost, and you can take the visits a number of times. So so it is like when there is a situation where you will be asked to visit a doctor regularly within the short period of time, it is recommended to take a capitated provider. Okay, so yeah, so if a patient uses fewer services, provider saves money. If the patient needs more care, provider bears extra cost. That is how the capitation works. Does this make sense, John? Because since you're
Yes.
working already into capitation, so this is how it works.
Yeah, absolutely. It makes sense, right? You're shifting the institutional funding to the provider, and they're responsible for the care. Yeah.
Correct. Okay. Next, COB. So what is COB? COB is coordination of benefits. When I say coordination of benefits, I told you earlier, right? So it is like when a member or a provider or anything, or an institution group who has dual eligibility, meaning when there is when they are enrolled into multiple plans. So when they are enrolled into multiple plans, which plan plays primary, which plan plays secondary. So all these are called coordination of benefits in Facets terminology. So sometimes a person has multiple insurance coverage, say an employer has, a spouse plan has, and a government coverage also has. So which plan should pay first? Primary plan, secondary plan? So I told you, right? So if your medical bill is somewhere around $10,000, insurance pays 70,000 as per your primary plan, and the remaining 3,000 gets paid by the secondary plan, and end up you might pay nothing or some amount from your pocket comparatively. So this is the major. So network is a collection of providers. Network group is a collection of network, and network set is a collection of network group. How would I explain this in a better way? Is network when you say New York, network group when you say multiple states like New York into America. So network set when you say collection of network group, like, so type of network. When you say in network, okay, I think these are all covered. So when you say in network, basically the cost will be very less comparatively. When there is a necessity to visit a provider or a provider or any services that you need to take it from out of network, the cost will be higher. And it is always important to see the plan whether the out of network is covered or not. If it is covered, then the insurance is going to pay, else you need to pay it from your pocket. So that is how it works. Next again, the most important terminology when you come into healthcare interfaces world is pre-authorization. So any idea about pre-authorization, John?
It's usually the health plan authorizing the service.
Not exactly. Okay, so pre-authorization is something like, let us consider you are a member being enrolled with some plan, and let's say your eyes has contract, and there is a necessity to, you're going to take cataract operation that is going to take a day or less than a day. Okay, but you'll know that which day you're going to perform the surgery before itself. It is not a kind of emergency surgery, something like that. It is all like pre-planned. So in that case, you need to go check your hospital, get the dates, get the appointment fixed for your surgery. uh, so these pre-existing things that you need to do before any services being taken. So these are all called pre-authorization. Whether pre-authorization is required or not, you need to check first. It is like, yes, get approval from insurance first, then receive the treatment. Go to the hospital, check for the vision. You're going to some prescriptions will be provided. Hey, your eye, we are going to perform some operation for cataract treatment. This is the amount which is necessary. So these many days or these many hours, this are the things. So split up will be provided by the provider. You need to get it submitted to the insurance company. Once the insurance company approves your thing, only then the service will be provided. This is called pre-authorization. Before starting a service, you're getting approval from your insurance company whether the service will be covered or not. That is called pre-authorization. In why pre-authorization is required? Confirm the treatment is medically necessary or not. First thing, ensure whether it is covered under the plan. Third one is to control unnecessary or expensive procedures. So that is the reason this pre-authorization is always necessary in claims processing. What services? Usually like surgeries, hospital admissions, any test like MRI, CT scans, or any specialized treatments or medications. So for all those things, you need pre-authorization. So here is one quick example. I would say like you have an insurance with Cigna and the doctor recommends you to take an MRI. what you should do, the hospital sends the either the hospital or you by yourself can send a pre-auth request to the insurer. The insurer reviews the request whether that MRI scan is really needed for your service or not. If it is approved, then the claims will be covered. If it is not approved, then you need to pay it from your own pocket. So that is how this pre-authorization works.
It makes sense.
Okay. Next is inpatient and out of patient. I think you're familiar with this. Inpatient is like inpatient care. Usually it requires hospital admission, stays 24 hours, and it is for anything like major serious surgeries or any accidental emergencies or any so those are any maternity things. So those type of all inpatient case, hospital stays for more than 24 hours are called inpatient stays. Usually like surgery, severe illness, ICU care, all are covered under inpatient. For outpatient, it is like OP visits, usually for like when you're it is not like you're going to stay in hospital for 24 hours. Patients can go home once after the visit is done. It is like uh, it is just, it can be just a fever or a cold or any regular checkups or just a consultation or any minor procedures like some stitches or some checkups like that. So all these are called outpatient care or outpatient services. Okay, I think with this I have covered almost all major. So procedure code, it is like what is the type of procedure that are being performed during the service or treatment being provided to the subscriber or a member. So these procedure codes are classified into two types: CPT codes and HIPICS codes. So CPT codes for doctor services, like a consultation or a surgery, whatever might be. HIPICS code is for supplies, equipments, ambulance services, durable medical equipments. So those things are all called, will be all covered under HIPICS code. So these are all basically 6-digit codes. Basically, it can be 5 numeric and 2 alphanumeric, I think, or a combination of both. Yeah.
I think you're right. Yeah.
Yes. So that is how it is structured. So diagnosis code. So diagnosis code is what kind of diagnosis that is being provided to the patient. So what type of disease? What is the reason for patient visit? So what type of let me say what type of suppose the patient requires blood test. What type of diagnosis, what type of treatment is being provided to the subscriber or member, all these are classified as diag code. So earlier it was ICD-9 codes, but in recent time we are using ICD-10 codes. So ICD-10 codes are typically 3 to 7 characteristics, combination of both letters and numerics. So here are a few diag codes for the reference, say J10 for influenza flu, E11 for type 2 diabetes, I10 for high blood pressure. Some point, and this points also refers like how depth the fracture is, fracture of femur. So how depth, where exactly, how much measurements, all those things will be replicated in this letters and numbers. So coming to revenue code is like a 3-digit code. So revenue code basically represents hospital billing to identify the type of service or what, under which department the patient is being admitted or patient is being provided with the service. So it is morely into hospital claim where uh, where it covers like room service, ambulance service, pharmacy. When you say CMS 500, outpatient medical professional claims, it is mandatory to file a CMS without a procedure code or a place of service, you cannot file a CMS 1500 claim. So UB04, you cannot bill a claim without type of bill and a revenue code. So type of bill, revenue code is mandate. Okay, next coming to NPI. NPI is a national identifier, provider identifier. Usually it is a 10-digit number which is assigned to a health care providers in United States. Okay, it is basically like an in India we
Yeah,
see it as a PAN card, Aadhaar card, right? So it is like a national identification number which is provided by the organization. It is mandated to have an NPI so that
yeah, it's like a social security number in America.
correct, security number.
Yeah.
So who needs an NPI? So here, so this is basically a government search website where you can search all your let me I'm giving in random. Let me check if we have anything. No records for. Okay, NPI number, and I have just given the enter. You can see like what is the name of this provider. So yes, what is the purpose of NPI? So identify providers, standardization, billing, reduce errors required for submitting insurance. So again, what are the types of NPI? Individual NPI and organizational NPI. So individual NPI, when you say it is for a doctor, dentist, organization, hospitals, clinics, and labs. It is not that only individuals can should have NPI number. Organizations do have NPI. So that types of tax ID is social security number, provider employer identification. So SSN is for individuals and EIN or TIN. We call it.